Caroline Kennedy's daughter, Tatiana Schlossberg, is coming forward with a devastating health update. The granddaughter of former President John F. Kennedy revealed in an emotional essay for The New Yorker that she has been battling a terminal cancer for the past year and a half after being diagnosed following the birth of her second child in May 2024. The diagnosis was acute myeloid leukemia with a rare mutation called inversion 3. It was mostly seen in older patients. Every doctor I saw asked me if I had spent a lot of time at Ground Zero, given how common blood cancers are among first responders. I was in New York on 9/11 in the 6th grade, but I didn't visit the site until years later. I am not elderly, I had just turned 34, she explained. Later in the essay, Schlossberg took aim at her cousin, Health and Human Services Secretary Robert F. Kennedy Jr., calling him an embarrassment. Meanwhile, during CAR-T treatment, a method developed over many decades with millions of dollars of government funding, my cousin, Robert F. Kennedy Jr., was in the process of being nominated and confirmed as the Secretary of Health and Human Services. Throughout my treatment, he had been on the national stage. Previously a Democrat, he was running for president as an independent, but mostly as an embarrassment to me and the rest of my immediate family, she said. The mom of two went on to detail her family's efforts to stop his confirmation, as her mother wrote a letter to the Senate, while her brother, Jack Schlossberg, also spoke out against him. She then expressed how fearful she became, highlighting his anti-vaccine views, writing in part, "Bobby's a known skeptic of vaccines, and I was especially concerned that I wouldn't be able to get mine again, leaving me to spend the rest of my life immunocompromised, along with millions of cancer survivors, small children, and the elderly. Bobby has said there's no vaccine that is safe and effective. Bobby probably doesn't remember the millions of people who were paralyzed or killed by polio before the vaccine was available." The journalist then detailed how his actions could affect her own care, saying, "As I spent more and more of my life under the care of doctors, nurses, and researchers striving to improve the lives of others, I watched as Bobby cut nearly $500 million for research into mRNA vaccines, technology that could be used against certain cancers, slashed billions in funding from the National Institutes of Health, the world's largest sponsor of medical research, and threatened to oust the panel of medical experts charged with recommending preventative cancer screenings. Hundreds of NIH grants and clinical trials were canceled, affecting thousands of patients. I worried about funding for leukemia and bone marrow research at Memorial Sloan Kettering. I worried about the trials that were my only shot at remission." She went on to reveal how a drug she previously used during her health battle is now flagged, detailing, "Early in my illness, when I had the postpartum hemorrhage, I was given a dose of misoprostol to help stop the bleeding. This drug is part of medication abortion, which, at Bobby's urging, is currently under review by the Food and Drug Administration. I freeze when I think about what would have happened if it had not been immediately available to me and to millions of other women who need it to save their lives or to get the care they deserve." The 35-year-old finished off her remarks about her cousin by noting that had she not gotten sick, she planned to write a book about oceans, and highlighted that she learned that one of her chemotherapy drugs, quote, owes its existence to an ocean animal, before elaborating, "This discovery was made by scientists at the University of California, Berkeley, who first synthesized the drug in 1959 and who almost certainly relied on government funding, the very thing that Bobby has already cut."